Why do total hip replacements dislocate or pop out of the joint, and what can I do to prevent it? My name is Dr. Dan Albright in Raleigh, North Carolina, and I focus on hip replacements, specifically anterior approach hip replacements. The hip is a ball and socket joint, and when you put an artificial ball and socket in, that ball can pop out of the socket unless the implants are positioned with the right angles and geometry and your muscles are holding in the hip joint. What matters a lot, in my opinion, is if the surgery is done from the anterior front approach or posterior approach. Both approaches work, and the long-term result is similar. Though with the posterior approach, typically, you're not supposed to bend for a month or two because you'll pop out. So if you get a posterior approach, which is an excellent approach, it's done across the country, no bending, no flexing your hip past 90 degrees, or it can pop out. I'm biased. I do the anterior approach and I have no restrictions because I don't want to worry about it popping out. I give my patients no restrictions. You can squat first day after. I believe that's an advantage. Any hip replacing can dislocate, there's no question. The hip is a ball and socket, artificial ball can come out of the socket. It's a rare problem. You generally don't need to worry about it, but it's a concern with every hip. Details beyond that, really, you need a conversation with your hip surgeon to go into more of the finer details of this topic. I'm happy to talk to you about this anytime at my office. Thank you.